Ladies and gentlemen, even the experts are conceding that this opioid plague is here to stay. They can't get rid of it. And how do you get rid of it when millions and millions of Americans are strung out on this stuff? Some of you may not know an opioid addict showed up at my doorstep last Wednesday and tried to get through my back door. He didn't make it in because my son was downstairs and he got his baseball bat. And as soon as he saw my son in the door with the bat, he backed away and then left my yard. That, ladies and gentlemen, is a demonstration of how bad this thing is. See, these folks are not getting their junkies off the streets like during the crack epidemic. During the crack epidemic, everybody went to jail. Mass incarceration had kicked off and everybody went to jail. Now, when most of the junkies are white, all of a sudden, jail is not the right place for them. They didn't seem to have this attitude during the crack epidemic. Putting everybody in jail was mighty fine to them. And I used to hear these people sit around at work talking about these crack addicts deserve to be in jail, but they don't seem to use those same words on their own people for obvious reasons. So they know this thing is lost. They know it's lost. And it has spiraled so badly out of control. There are millions of people stumbling around out here, all strung out on these opioids. And heroin is just another form of opioids as well. Okay, so how do you get rid of it when it's so much out here and so many people involved in this whole thing? All the rehab on the planet is not going to take this away from the average junkie. Look, 90% of them fall off the bandwagon shortly after leaving rehab. It's a very difficult thing to beat. I was reading a couple of years back, the opioids are the hardest addiction to break. It's the absolute hardest. And if you remember when they first marketed opioids, they said it was non-addictive. And this is why the doctor was giving it out to them like candy. They wouldn't give it to us like candy. Okay, but the people that are strung out, they were giving it to them like candy. 500 pills a pop. We certainly didn't get that. We got about 10 days, maybe 30 days the most. They tried to say Black people were going to sell this stuff, and we didn't. We were not the ones selling it. So this article came out January 28th, 2019. U.S. News Analysis. The opioid crisis is here to stay for years. So they can't do anything about this thing, y'all. When you got millions of people on this, how do you get rid of it? You can't. Okay, not unless you want to follow these people around every day to make sure they don't do drugs. And we know that's impossible. It's absolutely impossible. It's been 2 decades. I don't even believe the crack epidemic went on for 2 decades. But we were able to break it in the Black community. But it's very different now, y'all. This is definitely not the same. Trends that seem apparent in hindsight escape notice for years, with the failure to recognize a climb in deaths at the turn of the millennium, along with a subsequent slowdown, raising a compelling question. Do policymakers, law enforcement, and public health officials miss chances to curb the opioid plague before it became a full-blown emergency? No. Ladies and gentlemen, there is no agency on this earth that can stop this plague from going on at this point. 20 years later, 20 years in, millions of people strung out, you can't stop it now. And it's not going to die out as long as you have fentanyl and all kinds of drugs flowing in here from China and Mexico and from the islands and from Canada. You got it coming in from all borders. The crisis is that we don't understand the crisis. Because of that, countless lives have been lost, says Rocco Prella, co-founder of a new nonprofit, the Health Initiative. Prella carried out the analysis at the U.S. News request with the assistance of Lloyd Provost, a statistician with the consulting firm Associates in Process Improvement. The analysis of data from the Center for Disease Control and Prevention, and that agency has always undercounted this plague. So any numbers that come from them, it's a lowball number. Offers a clearer understanding of the unfolding plague. It indicates that opioids mortality has been climbing since at least the late 1990s, following an advent of the long-lasting opioid painkiller OxyContin. Starting in 2007, the death toll slowed for a time as doctors began limiting access to legally prescribed opioids. The demand fueled by those cutbacks led desperate users to turn to heroin and the ultra-potent fentanyl, fueling a shift that caused overdose deaths to start skyrocketing in 2014. The opioid death rate reached its recent peak at 14.9 deaths per 100,000 people in 2017, with little sign of true progress since then. So they're admitting that since 2014, all the way up until now, there has been no progress made in curbing this plague. So as you can see how this chart is constantly climbing from 1999 all the way to 2018, you see no end in sight. And it's right here, phase 3, getting worse. So it has not plateaued at all. Now, I saw some articles in the past that tried to say it plateaued, but I knew that wasn't true. I knew it wasn't true. Now, as a deluge of illicit fentanyl has flooded the country, much of it through the U.S. Postal Service and allegedly from China, some experts fear America's opioid plague will remain at its current lethal level with no true end in sight. That would be almost as bad as if, for some reason, the plague kept growing, says Dr. Daniel Ciccarone, a heroin researcher and professor at the University of California, San Francisco. Fentanyl and its cousins, the analogs, are not going away. No, they're not. See, it's called supply and demand. As long as your junkies are demanding the drug, it will always be flowing in. At this rate of decline in mortality, we have a large problem, a huge problem for the next 10 years. The number of deaths is still unacceptably high. So they know already, this is 2019, so 2029, They already know this thing is going to go on strong. There's not going to be anybody left, y'all. And they know this is bad. And see, ladies and gentlemen, I know it's bad when they come to me and tell me to stop doing these stories, or certain people crop up and try to falsify my picture with someone else, because see, it's a way of trying to silence me from doing these stories. And I'm not going to stop doing these stories. I'm not. I don't care. Put up more pictures if you like. I'm not going to stop doing these stories. I'm going to continue on. Just like I'm not going to stop doing stories on Trump. So there'll be more bags of tricks to try to silence me, but it won't work. All right. So now you see opioid deaths by race. So I'm going to skip down so that you can see this chart. Now you see American Indians or Alaskan Natives. It's been rising among them. Asian Pacific Islander. It's a slow increase, but it's definitely an increase there. And you see Black and white, which is the absolute highest. Okay. So, to make a long story short, y'all, every corner of America has been impacted by these opioids. And that's another thing. For the first time, I'm seeing them admit this in the article. Perla analysis show that no region has gone completely unscathed, regardless of political ideology or the robustness of its economy. In 2017, for example, reliably blue Massachusetts had a death rate of 28.2 per 100,000, relatively on par with reliably red Kentucky with a death rate of 27.9 per 100,000. Monat agrees that trends identified in the U.S. news analysis, if detected early, might have served as an early warning of how bad the plague would become. So, hindsight 2020, the reason why this thing spiraled out of control, y'all, is because for a long time, over those 2 decades, they ignored all of these high people that were around them. They didn't pay attention. Now, as of 2014, they started paying attention. And this government started trying to push all kinds of policies, but by then, it was already too late. So now, what do? They go to the Trump administration to try to push this public health emergency. And we see, even with that, nothing has slowed down. Nothing. The death rates are higher than ever. In fact, even higher because of the fentanyl. So this is long term, y'all. It's indefinite. Trust me, it's going to go beyond the 10 years. It's indefinite. That's what this plague is. So they're just going over some of the deaths related to opioids. And you can see Ohio has definitely been an epicenter in all of these deaths, as well as Pennsylvania, West Virginia. There are just certain locations that are exceptionally bad. And Ohio is definitely, it's one of those locations that have seen massive amounts of deaths. Okay, so it's just going over the different states and how they've been impacted. So, what I will do, ladies and gentlemen, I will leave the link to this article in the description. So they are telling you this opioid plague, it's not going anywhere. They're losing so many people. And, and I'm not surprised about the black number, only because the longer the drug addiction goes on, you're going to get more and more black people in there. So, but it's still far behind the white deaths. It's completely far behind that. But please tell me what you think, ladies and gentlemen, about what is finally coming out on Newsweek. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.